Hey guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, subscribe and follow the playlist from the beginning so that you understand every concept thoroughly. This is part 20 of the Inpatient Coding Series, and today we will learn about the importance of the root operations in the PCS coding. I am Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have trained many individuals and helped them clear their certifications both from AHIMA and AAPC. At the end of this learning session, we will have a better understanding of coding Excision from the first group of root operations. We will take examples of coding from the medical and surgical section since the medical and surgical section is the most important and the biggest section in the ICD-10 PCS coding. These are the 9 groups of root operations which are grouped based on similar attributes of surgical procedures. Today, we are looking at the first group which talks about root operations that take out some or all of a body part. There are 5 root operations in this first group. Excision, which goes by the character value B, resection, which is T, detachment, which is 6, destruction, which goes by the character value 5, and extraction, which goes by D. These are the 5 root operations in group number 1. And out of this, today we are talking about the root operation, specifically excision, which carries a character value of B. Root operations are the most important aspect of building a PCS code, and remember that root operations define the objective or the goal of the procedure. So always read the definition of the root operation and compare it to the procedure that is performed so that you can identify the correct root operation. Excision. So excision is defined as cutting out or off without a replacement a portion of a body part. Almost all biopsy procedures are coded to this root operation, and the qualifier value is diagnostic in such biopsy procedures. Examples include partial nephrectomy, liver biopsy, breast lumpectomy, breast reduction, and excisional debridement. Remember, there is another similar root operation which is resection. Now, the difference between excision and resection is excision is defined as uh, removal or cutting off portion of a body part, whereas resection is defined as removal or cutting off all of a body part. That's the basic difference between excision and resection. Now, there are 2 important exceptions in this root operation excision. One exception is breast reduction that is performed for cosmetic reasons should be coded to alteration as the root operation. And the second exception is non-excisional debridement that is coded to extraction as the root operation. These are 2 important exceptions that you might need to remember. Now, excision procedures. Generally, sharp instruments such as scalpels or scissors, wires, bone saw, or electrocautery tips are used generally to perform excision procedures. 2 more procedures that you need to remember are bone marrow biopsy and endometrial biopsy. Though the term biopsy is used, these 2 procedures are coded to the root operation extraction since there is no cutting of tissue involved in these 2 procedures. These are 2 more exceptions that you might need to remember. They are not coded to excision as the root operation. This is an example of coding excision procedures. The patient is admitted for a vertical sleeve gastrectomy for weight loss. The greater curvature of the stomach is removed laparoscopically. So if you have to code this one, this is how the table looks like. Okay, the corresponding table for the gastrectomy procedure. The section is medical and surgical. Body system is gastrointestinal. Root operation is excision, since only the greater curvature is removed. And the body part is stomach. Approach is percutaneous endoscopic, since the procedure is done laparoscopically. Remember, all laparoscopic procedures are coded to the approach value of percutaneous endoscopic. Then there is no device involved. And the qualifier in this case is vertical for the vertical sleeve gastrectomy. So the qualifier always provides additional information about the procedure performed. So the code for this procedure would be 0, D, B, 6, 4, Z and 3. So the key points to remember are bone marrow and endometrial biopsies are not coded to excision. They are actually coded to extraction as the root operation, and the qualifier value will be diagnostic or an X. Breast reduction procedures for cosmetic reasons are coded to alteration as the root operation, and non-excisional debridements are coded to the root operation extraction. These are the important points you'll need to remember when it comes to the excision as the root operation. As always, you'll find the online version of the ICD-10-PCS from this link. I have provided the same link in the description of the video as well. You can download the PDF from there. Thank you guys. Thank you for watching. Please subscribe to the channel if you have not done that already, and follow the series from the playlist. I'm going to make different playlists for different set of videos. Like PCS will be a separate playlist, and CPT will be a separate playlist, and ICD-10-CM will be a separate playlist. That will help you follow the series in an order. Okay, and in the next set of videos, we'll talk about the medical and surgical section, the other root operations, and also the guidelines for the ICD-10 PCS.